Welcome to Rethinking Running Rehab, or RX3. I'm Dr. Beau Beard. I'm a sports chiropractor and human performance specialist. I've been involved in running in some shape, way, or form for the better part of the past 2 decades. First getting into trail running in about 2003 when I lived in Alaska, and kept evolving slowly because I didn't come from a typical endurance background. Kept running, but it wasn't anything fancy. I got beat by a mom in a trike stroller in my first 5K, so that was humbling, but also stoked the fire to keep training. And then as I moved to St. Louis to go to graduate school in 2009, that coincided with Christopher McDougall's book Born to Run coming out, and that sent me further down the rabbit hole of running, trail running, the barefoot running movement that was occurring at that time. And all of these things kept percolating through my mind as I went through and finished graduate school, got into the running world even deeper when I got into practice in Birmingham, Alabama here, where I run the farm along with my wife, Dr. Sloan Beard. And we got heavily involved in the trail running world, and I started to compete at a higher and higher level, was lucky enough to run all over North America in a variety of races. And I started to just kind of ask myself, well, why am I not getting some of these athletes better? And then, how is the paradigm from which I was taught, maybe not setting me up for, the greatest level of success with a running athlete? Hence, where I said, well, I think I need to rethink what I'm doing. And if I can rethink what I'm doing, maybe there is an opportunity for other people to learn from my mistakes and something that I've kind of distilled and then brought into this course. And that's what we're going to try to do. So like I said, one of the first things that I realized was that there was a problem. I wasn't getting the results that I wanted. And I think this permeates a lot of the running injury and treatment paradigm, is that we see, a heavily orthopedically influenced treatment guidelines from a running standpoint of just like, oh, you're hurt, let's rest. Oh, we have a slight, bone stress injury, let's boot you. You have pain in your foot, it's plantar fasciitis. Just a very antiquated approach. That's why I love this author. We got a couple of his books back on the shelf back here. But when we look at this, quote from The Black Swan by Nassim Nicholas Taleb, the problem with experts is that they do not know what they do not know. We could call this the Dunning-Kruger effect. We could call this the curse of knowledge. We get enough information. So, I talk about it as like we're working towards competent confusion, realizing that everybody at the top of their field realizes like, oh my gosh, there's so much that I don't know, because they have dug and uncovered, like an archaeologist, all the information that they do own. And they just kind of start realizing like, I'm never going to own it all. So I'm not going to be, I can never be 100% competent on all of the information out there. I can only be as competent as I can with what I have. But what we see tend to happen within our field, in my opinion, in chiropractic, physical therapy, training, coaching, is we almost approach it in a manner of maybe knowing that we can't know it all. So then that shuts us down, makes us a little dogmatic, a little too protocolish, and pretty soon it's, well, this is the way we do it. And then, maybe we use stringent guidelines, or we say we're evidence-based, and then that actually chains us. It shuts us down. It closes down our mind instead of opening it up. And then we're not growing as a person or a practitioner, and we're definitely not helping our athletes as best as we could. So again, talking about, having a shelf full of books back here, another quote from the same book: read books are far less valuable than unread ones. The library should contain as much of what you do not know. So he talks about in this chapter that if you looked at an amateur book collector, somebody that's building a library, and somebody came over to have drinks, and they're, hoity-toitying around their library, that the novice book collector would be, talking about the books they have read and, pulling quotes from them maybe. But that the classic book collector, the professional, the consummate expert book collector would say, there are all these books on these shelves that I have not yet read, but I know that they're filled with knowledge that could help me or somebody else. And I don't know if I'll ever get to them, but at least I'm aware that they exist. That's what I'm trying to do in this course. Most of this is from my opinion. It's from my perspective. There's no way I can say it's right or wrong. All I can say is, this is my perspective. I've had gaps in my own knowledge. I still do. I always will. And I hope that I can help fill in some for you, or at least create a thought process that sends you on your own journey. So again, what are those missing puzzle pieces, in my opinion, in the running world in particular? I think that these are some of the bigger ones. Why do we see this mountain of running injuries occur every year? And then overall, if we just looked at any one point in time, people out there running. So if we looked at the rate of running injuries for people that pick up running at any point in their running career, we're going to see about 80% of those people are going to get injured at some point in time. So that's a pretty high stat for a movement that is normal for 70-80% of humans that go through normal, the neurodevelopmental cycle. So it's pretty wild. It's not like we're saying, oh, all these people are getting hurt playing squash. That is a derived, sport or movement. No, it's something that we all tend to do on our own. Why are some people plagued with chronic injuries while others aren't? So, we look at a friend group, a running group, whatever it is, a run club, and we see that there's, a couple people in there just always getting injured. There's other people, regardless of volume, the amount of races they do, they may get a little banged up, but they're never getting sidelined. We'll talk about all of the, what we'll call an ecosystems approach, not just the biomechanics and the physiology, but what surrounds them from all the way from genetics, epigenetics, rest, recovery, food, hydration, sleep, all of the things that surround that person that may be allowing them to thrive regardless of the training, whereas other people, cycle down the dark well of despair of injury time and time again with lower and lower amounts of volume or training intensity. And we'll talk about all that and try to suss that out as best as we can. What value should we place on proper mechanics? We'll talk about this a lot because I am a biomechanics nerd. I do think it's important to understand running gait analysis and what that encompasses. And we'll also talk about when should we or do we need to change gait in order to have positive injury outcomes, because one thing that I think is extremely dogmatic within the running PT, chiro, treatment, coaching world is a runner comes in with an injury and we immediately gravitate towards their running gait. I can understand why, but which we'll talk about in depth, if we look at something from a system standpoint, like dynamic systems theory and how we approach the idea of human movement, it starts to become maybe a little illogical to start with one of the highest level movements, human running. It's a very complex movement, and say there has to be a problem there rather than some attractor state, a stiff ankle, a lack of sleep, whatever it is that's leading to pain, pathway anatomical disruption, whatever it is, and then allow running to be expressed however it's going to be expressed based on 1,000 variables of the human organism in front of you. So what are our goals? The goals throughout this course, which will take us 10, 12 modules, is to have a world-class assessment of a runner. I teach another course called The Art of Assessment. That course came because I started working through this Rethinking Running Rehab course and realized I'm going to have to teach a lot of assessment to get people proficient, get professionals proficient in the concept of being aware of all the variables. So assessment to me is critical. I think if you can have a world-class assessment, and I don't want to say a world-class diagnosis, but we would say a functional diagnosis of a functional audit, pain audit, all these things, what you're going to do is make all of your treatment tools that much better. It's an amplifier effect, because let's say I'm only equipped with the very standard, post-school set of, as a chiropractor. So, but let's say PT, chiropractor, osteopath, we can adjust or manipulate. We can do some soft tissue. We can do exercise, and let's say both corrective and load management, that we can go into the training side. That's all I have. Those tools become more sniper-esque if I can aim them more appropriately. Phenotyping runners, the runner screen and gait analysis. We can subgroup runners into classifications based on soft tissue compliance, based on what type of training volume or intensity they'll be well at or do well at, chronotyping, and we can create a phenotype. And it's not that it holds completely true that it's a black or white phenotype. It just helps us guide their treatment a little bit based on who they are as a person. The runner screen, this is my attempt to take, if you're familiar with, Gray Cook and Gray Gross's functional movement systems or selective functional movement assessment, of saying, well, let's steal some of those movements, some other things that we know are important in the running world that are requisites to be able to run, smash those all together, and then put somebody through a screen, either beginning of care, at the end of care, if you're a coach, pre-assessment, say, hey, these are things we should be able to do. If you can't do these, they leave gaps in your requisite foundation of running, and that could set us up for injury or at least a lack of performance. And then we've already said that we will dive into gait analysis because I do think it's important. And then we got to also decipher when is it the trigger to pull. Understand the importance of aerobic capacity in the injury paradigm. If you notice, I don't just say the running injury paradigm because I'll try to explain the importance of aerobic capacity, over how it plays into just pain overall, the occurrence of injury, the overall well-being and longevity. So it's wildly important, becoming more appreciated, but then how do we use that in the treatment paradigm? We said before we'll talk about when and how to um, alter running for rehab and performance. And before we dive into the last goal, I want to talk about like a semantics issue. So to kind of be a little tongue in cheek, obviously we know that there is a difference here. I laugh. I'm not going to point it out unless maybe, it's, we can both have a laugh, but patients will say this all the time, or we see things that are typed up wrong, whatever. If you went in for surgery and they mix these two up, you'd probably be pretty upset. I bring this up because if we can't define basic things like aerobic capacity, like what VO2 max means, what muscular endurance means, uh, how much volume should have somebody be. If we can't get the semantics down, the foundation of communication breaks down. And if we don't have a vocabulary of which we all somewhat agree upon, then the conjecture goes through the roof, which we already live in a profession where the conjecture is just rampant. So I'm going to try to break these things down into easily digestible definitions so then we can use those definitions throughout the rest of the course. That being said, our last goal is to realize that I don't think we're ever treating an injury. We are managing an organism. And when I say manage an organism, some people may cringe or, have a little drawback because they think that we're talking, especially coming from a chiropractor, they're talking about keeping people on maintenance plans and some sort of concept of we need to keep them with us from a business standpoint. Yes, does it help your business to keep people alive within the practice walls? Sure. And I don't mean alive like don't kill them. I mean alive like a thriving patient that's always returning. But you're managing them because the likelihood of people being ultimately healthy nowadays when people are becoming more and more unhealthy is getting less and less. So it's not just about the musculoskeletal, it's about the ecosystem approach. It's also about checking in on most people because just like your car, if most people need to get their ankles moving or need to get their mid back moving or run, they're upping the volume for a marathon training block, you have a job that you can help elucidate things that they're unaware of, at least whether you think that you should do hands-on treatment or not. The goal is what? Lead with the world-class assessment. Excuse me. Lead with the world-class assessment and then show them like, hey, this is stiff. Remember, we've pointed this out before. Hey, I can tell as you're running more, like your calves are getting super wound up. Let's like try to get ahead of that and just maybe it's having them do it. But we are managing these people. Now, are we managing them for life? That's up to them and you as a therapeutic alliance. But I think it's more of a dance rather than a treat an Achilles tendonitis, see you later. It's a hey, let's have a partnership. Use me more when you need me. So if we're talking about running through higher volume training blocks, use me less if you're in an off season, you're doing something different. Use me in a different capacity. Use me if a lot of people nowadays are a hybrid of a strength coach and a PT or chiro. Use me for the strength coach side for our middle school, high school runners in the off season when they desperately need it. So if you're not a photography nerd like me, which you will see photos dripped into this presentation, maybe just for a little, added pat on the back for me. But this is David Yarrow. He's one of the highest grossing current photographers in the world. Sells high contrast, in your face, black and white photos for upwards of $300,000, $400,000. Why do I bring him up? I bring him up because I have a camera. He has a camera. We look through a lens. We could see the same thing through the lens. He takes pictures of a lot of African wildlife. That's what he was made famous for, elephants in particular. So let's say David Yarrow and I go on safari together in South Sudan, and we're both looking at the same elephant. Well, he takes a picture, I take a picture. We both go process it on our computers, our digital dark rooms. We both print it out, and I'm desperately aware of how much better I like David Yarrow's. Why? His perspective, his taste, his take on it it for me is more appealing, even though I'm me. That's why I would pay money for his photo. And I'm like, I'm not able to do that. There's a technical skill there for sure. But if we had the same equipment, we're pushing the same button, we have the same exposure and the same, all the technical things the same, why would his be better? It's his vision, his composition, putting it all together, what he does in post production. That is what we do as practitioners. That's the art, blended with the science of, well, what's our take on it? This is my take on treating the running athlete and how we approach that, like I said numerous times already, in an ecosystem approach. So just because I'm looking through my lens does not mean that this is right. All it means is that I'm looking through my lens. And because it is my lens, I am more than happy to have discussions, be proven wrong, change my mind. I've had research crawlers on running related injuries delivering the top 10 articles in running related injury or performance over the past decade. And that's only 10 articles every 2 weeks. And I'll, maybe read more of those. I don't read all of them. It's impossible to get ahead of it. And just like I'm looking out into the ocean taking the shot, the amount of information on just running, if we're not talking like human, and if we, we can, so our big circle would be what? Medicine, health, treatment of a patient. Then it gets into, for us in particular, I'm assuming if you're taking this course, conservative musculoskeletal care. I'm trying to shrink it down further to make it easier to hone in on a subset of athletes, of the running athlete. And even within that microcosm, it's still an ocean of information, and the ocean is growing every day because we're in this technological explosion right now that is allowing information all to be mined or developed faster, but also proliferated a lot easier. And because of that, you can only do your best. And then I hope I become somewhat of a guide or a guidepost saying this is kind of my take on it. I've looked through a lot of this information. I have, over a decade of experience. I'm also out there hitting the trails. I'm in the trenches and trying to put all three of those together to say, this is my take. This is what I've come up with. And I hope it helps. And I do hope it helps. And I hope you enjoy the rest of the course.